I met my husband, future husband, when I was 24, I guess, 23, 24, down here at Wayne State University. And we got married like a year later. And he had told me that he had something called hemophilia, which I vaguely knew what that was from back in school when I had done a report on the Russian royal family, and I knew it was a bleeding problem. I didn't know a whole lot about it, but I knew what it was. I wasn't afraid of it. I mean, everybody had something. I did, right? I had my background, my health issues. And he was very hopeful at that time because he said, there's these new products being made, and people will be able to take these medications, and they don't have to go to the hospital anymore when they have these bleeds and stuff like that. So he said, and probably, he said, in my lifetime they're going to come up with a cure for hemophilia. My daughter was with me still, and I remember as they shut the door, all the medical people that had been in the room, which was about 7 people, walked out, and now I was just with the nurse, and she looked at me and she said, "Are you all right?" Like, I'm never going to be all right again. How can I be all right? My world just blew up in my face. I was 27, and I was just told I was going to be dead in 2 years. I don't know if I'm supposed to be all right. They let us know that we were both infected. They also let us know that most people who tested positive died within 18 months to 2 years. And that we should probably find somebody to raise my daughter, because we probably wouldn't be around. We found out we both had HIV, but my daughter, who was a year and a half old at that point, had tested negative, although they weren't sure she would remain negative because they didn't know, all the stuff they know now. They were all very, very matter of fact, telling you, you want the good news, you want the bad news, good news is your daughter doesn't have it. The bad news is you guys have this. And of course, we didn't know anything about HIV. Nobody knew anything at that time. We're talking, this was 85. It wasn't really it wasn't out there. The information wasn't out there. And they were very matter of fact about it. And then, I was like, okay, so do you have any questions for us? Well, I just got a terminal diagnosis, and, I have like 8 million questions in my brain, but I couldn't speak one, And I just remember, like, both of my husband and I were like, no, we don't have any questions, And I understand now, looking back, I understand that the medical people themselves were overwhelmed and shocked with what they had found during this study, because it was a prevalence study. It wasn't a study so they could tell people, oh, you're HIV positive and we can do something for you, because they couldn't. It was just a prevalence study. So I know, like I said, looking back now, that they found at the time, there were people, it was over 90% of the hemophiliacs that had been exposed to these products were HIV positive. I mean, that's an entire population of people. So they were overwhelmed and they couldn't deal with it. My name is Kathy Gerus-Darbison, and I've been living with HIV infection since 1984, when I was 27 years old. I'm 57 now, so it's a long time. I'm a professor of sociology at a couple different community colleges here in Michigan, and I do nonprofit work with an organization that I started myself about 16 years ago called Stitches Women's Initiatives. The doctors that make a difference in people's lives are the ones that listen to them and ask questions, and really pay attention to what their patients have to say. He was this beautiful, tall Indian man, drop dead gorgeous. That helps. That helps, okay? Great smile, give you that smile and you're like, okay, I feel better already, you know? And the thing that I loved about him, he was in the room when they were gonna start the procedure, and you know, you're in a gown, you know, your butt's hanging out, you know, you feel the worst, you know, it's like the most vulnerable you could possibly be. And as they're giving me the medication, he put his hand on my hip and he just kind of rolled it back and forth and said, everything's gonna be just fine. That's all. Everything's gonna be just fine. And that was the last thing that I remembered, right? As the medication took over and I was like, whoop, out. That right there is what I'm talking about. It doesn't take much. It's not like a really important specific formula that you have to follow. It's just connecting with people so that they feel, right, that you care. Even just a little bit, you know, right? So it could be a touch on somebody's shoulder. You might be a medical doctor and that's your job, right? But there are other issues that people are dealing with in their lives, you know. They're complex human beings. So if you can assist them in any other ways to, you know, get along better, then that's good on you. That's good on you. Probably the most important thing, if I was going to tell, you know, like students, medical students, you know, like, what could you do? What one thing could you do, right, that would make you a better doctor? And I would say, how about looking in people's eyes? How about connecting with that person and seeing them as a person, right? And understanding that, like for a moment, you know, it's like namaste, right? You know, I recognize the divine in you. You know, my divine divinity recognizes yours, and we're kind of the same. I was very, very lucky to find down here at DMC, Dr. Sobel, who helped me out a lot. I mean, he's a wonderful women's doctor. They were also, he's a research person, and both him and the nurse that he was with were really wonderful. And I remember my new husband coming in with me into the room when I was, you know, meeting with Dr. Sobel, and Dr. Sobel's a big feminist, right? So I instantly fell in love with him, you know. And he's all about, you know, he's very much for women and empowering women and stuff. And he was, again, so kind. I never felt rushed, you know, when I was talking to him. You know, truly he cares about, you can tell he cares about you as a person. Humanism is caring about another person as much as you care about yourself.